So today we are going to start about general physical examination, that how basically any examination should be started. So regarding examination, and especially the general physical examination, always approach from the right side of the patient, introduce yourself and ask for permission. Now, while doing so, be gentle and polite and offer a handshake, which will basically give a reassurance about the patient and will give some uh, clues about the different condition like hyperthyroidism, hypothyroidism, anxiety, etc. Then give a quick look to the patient from head to toe, and also give a quick look to the surrounding of the patient and see what you can find, what the medicines or any other thing in the surrounding which can give you some clue about the diagnosis. Then look at the facial expression of the patient. Also give a look to the height of the patient, the appearance of the patient, and then the main points which we are not going to discuss in detail, but the points which you should be able to see in the general physical examination are basically the appearance of the patient, the build of the patient, the nutrition of the patient, anemia, jaundice, cyanosis, clubbing, Koilonychia. Now we are not going into detail in this lecture. We will definitely discuss these things in detail, that what are the causes, how to look for it, but you should have this synopsis in your mind while doing a general physical examination, that while in the GPE you should be able to at least look for these things: anemia, jaundice, cyanosis, clubbing, koilonychia, leukonychia. What is koilonychia? What is leukonychia? We are going to discuss these in the detail in the coming lectures. Then you should check for edema, dehydration, lymph nodes, pigmentation. Also check for thyroid gland, breasts, hair distribution. Pulse, blood pressure, temperature and respiratory rate are very important. These things are very important. It must not be missed. So let's revise it. We will revise it 2 times. Approach the patient from the right side, introduce yourself, ask for permission, be gentle and polite, offer a handshake, give a quick look to the patient from head to toe, then look at the facial expression of the patient. The facial expression will give some clues about the diagnosis. Then look at the height of the patient, the appearance of the patient, the build of the patient, nutrition of the patient, whether the patient is malnourished or obese or whatever. So the build and the appearance, the build and the nutrition combined will give a clue. Then check for anemia, jaundice, cyanosis, clubbing, koilonychia, leukonychia, edema, dehydration, lymph nodes, pigmentation, thyroid gland, breast, hair distribution, and finally don't forget to check the pulse, blood pressure, temperature and respiratory rate. This is the main synopsis, which is basically covering most of the points which should be covered in GPE or general physical examination. So let's summarize it once again and the last time. So always approach the patient from the right side, always introduce yourself, always take permission, be gentle and polite all the time. Always offer a handshake, especially if you are a male and the patient is also a male, or if you are a female and the patient is a female. If it's not like that, then handshake may be skipped. So according to the culture, depends upon the culture of the country. Then give a quick look to the patient, check the facial expression of the patient, or examine the look at the facial expression, which may give you some clue about the diagnosis. Don't forget to look at the height, appearance, build and nutrition of the patient, and always check anemia, jaundice, cyanosis, clubbing, koilonychia, leukonychia, edema, dehydration, lymph nodes, pigmentations. Finally, thyroid gland, breast and hair distribution. And don't forget to check pulse, blood pressure, temperature and respiratory rate. That's how you have to start the general physical examination. And then slowly and gradually we will proceed and we will discuss each and everything. We will discuss the facial expression, we will discuss anemia, causes of anemia, how to check anemia. Then we will examine in detail and we'll discuss in detail jaundice, cyanosis, clubbing, each and everything will be discussed in detail. Thanks a lot for watching the